So one of our former postdocs, Ruthie Greenberg, had a patient who had a bridge phobia, and he had to go over the Benjamin Franklin Bridge in order to get to New Jersey from Philadelphia, and there are a lot of reasons for his wanting to go over the bridge, but one of them was that his children were dying to go to one of the amusement parks. And in fact, he had, in his mind, foolishly promised them that he was going to take them to the amusement park. And so Ruthie arranged for him to get in the car with the children. He was going to drive the car. And they had a walkie-talkie. Nowadays, it would have been a cell phone. They had a walkie-talkie, and Ruth was back in her office with a walkie-talkie, and he was driving over the bridge. And while he's driving, he starts to say, "Oh, I'm beginning to feel more and more anxious." And then he gets to the middle of the bridge, and he says, "I feel that the car is now going over the railing, and it's starting to fall into the river." And Ruthie says, "No, just check and see. Look up ahead and refocus." And he looked ahead and refocused, and he saw that the car was not going over the railing into the river. And so then he managed to get to the other side, and then he said, I feel better. And then the kids started to cheer. They clapped their hands. And he got over his bridge phobia.
And right in the office, though, you can use imagery. Really try to get the person to imagine as if this is happening right now. Yeah. And there's so many videos now on YouTube. There was an interesting discussion on the Academy of Cognitive Therapy listserv, was it last year, about the fear of vomiting. And people came in with all kinds of vomiting recipes that you could make. And they also had lists of videos from YouTube. You can Google things like, I don't know, bridge phobia or bridge collapse or things like that, and expose people that way. So yes, right. You can start right in the office that way.
So how do you feel somebody with a fear of vomiting?
Oh, you make the vomit. You make this what looks like vomit, and then you can show videos of people vomiting. There were recipes to actually
make it. So it's desensitization, basically.
Yes.
Rather than a behavioral experiment.
Well, the behavioral experiment part was, if I even see something that looks like vomit, then I'll have a panic attack. I won't be able to stand it. I'll vomit myself.
Right. So they discover that vomiting is not serious.
Yes.
Yep.
But they have to prove it to themselves.